Good day everyone, I am Andre, your science student nurse for the day, and I am here to perform and demonstrate the evaluation checklist performing the bag technique for the home visits. The first thing we need to do is we need to gather all our equipment needed. So I have here the PHN bag, which contains all its content and all other paraphernalia that we're going to use for the home visits. Like for example, a CHN logbook. After that, we need to identify who will be our patient and gather all the necessary data needed for the home visit. We can use the RH family logbook, or we can ask the other member of the healthcare team who has handled the client. After locating and greeting the client, we're now going to introduce ourselves, state the purpose of the home visits, and explain what we're going to do. Good day, ma'am and sir. I am Andre, your science student nurse for the day, and I am here to perform the bag technique for the home visit. The bag technique is necessary to prevent any spread of any infection. After that, we're now going to observe and identify the specific healthcare needs of our client. Of course, we're going to provide for our client's privacy also by drawing the curtain and closing the door of the room. For our planning, we're going to formulate a nursing objective, prioritizing the essential and prioritize healthcare needs of our client, the specific healthcare needs of our client. It is for the individual and family. The rendering of care or the providing of healthcare, it should be also for individual and family. Take note that our planning, it should be flexible. For our implementation, upon arriving at the client's home, we're going to place a paper lining on the top of the table or on any clean flat surface. After the paper lining, we're going to place also a plastic lining. After that, we're going to put down our bag on the top of the plastic lining, tacking down or tacking the handles beneath the bag. We need to take note that our bag must be or should be 6 feet away from our client. After that, we're going to ask for a basin of water or dipper of water if any faucets are not available. We're going to place the basin of water or dipper of water outside on our working area. We're now going to open the bag and take away the hand towel, soap dish, and of course our apron. We're going to place them on one corner of our working area within confining at the plastic lining. We're now going to close our bag and perform the hand washing or hand hygiene by using the towel. We're going to wipe and dry our hands. After the hand washing or hand hygiene, we're now going to wear our apron. In wearing our apron, the right side out, wrong side in. The apron should be creased, touching our body. So I'm now going to slide my head towards the next strap and neatly tie the other strap at the back. After that, I am now going to open my bag again and take out all other equipment that I am going to use for the specific healthcare needs of my client. So, like for example, a basin, cotton balls, alcohol, the BP apparatus, and the thermometer. And of course, our paper waste receptacle. Our client here, it can be pregnant mother, postpartum and the newborn, a school-age child, a morbidity case, and a family load case. After that, we're going to place the paperweight receptacle for our race on one corner of our working area. We're now going to proceed on the specific healthcare of our client. Like for example, my client here is a pregnant mother. I am going to take her vital signs by taking his BP, his blood pressure, his respiratory rate, her pulse rate, and her temperature. After providing the specific healthcare of our client, we're now going to wash and clean the equipment that we have been used. So after washing and cleaning, we're going to clean it using a 70% after alcohol. After washing and cleaning, we're now going to put back the articles on their proper place in our station bag. After that, we're now going to clean and do hand washing again. After doing the hand washing, we're now going to take out our apron and folding it sole part inward. And before putting it on our station bag, we need to place it first on a plastic bag. After that, we're now going to clean and fold also our plastic lining and paper lining. We need to place them as well on a plastic bag before putting them back on our station bag. We need to make sure also that we're going to leave our working area neat and clean. After that, we're going to make a post-visit conference on matter relevant to healthcare by taking an anecdotal notes preparatory for making a final report on our CHN logbook. We need to take note also for the environment of our client affecting their client health status. And we need to make also another appointment of our client for our next visit. Like what I said a while ago, my patient here is a pregnant mother, so ma'am, we will be back at the on October 12 at 9 a.m. in the morning for I will be digging again your vital signs. Because it can be a clinical or home visits. After that, for our evaluation, we need to document all our relevant findings, our observation, and the identified healthcare needs of our client. We need to include also the quality of patient and nurse care, and we need to take note also for the nursing care being rendered and evaluate the effectiveness of the nursing care being provided. And if there is any aberration for the normal findings, we need to refer our client into the RHU.